It all began 50 years ago as a modest social experiment during America's war on poverty. The goal? To bring doctors and primary and preventative health services into poor urban and rural communities, places where health needs were neglected and ignored by mainstream medicine. A revolutionary partnership was created, bringing together for the first time reform-minded physicians, nurses, local community leaders, and the federal government to build a new type of community-based health care. It would serve all people, no matter who they were, where they lived, regardless of income or insurance status. And it would empower and give voice to people living and working in those communities to direct how health care was to be delivered. That small investment 5 decades ago has saved countless lives and strengthened thousands of communities. Today, community health centers stand as the largest and most successful primary care system in America. Through their shared mission, they provide high-quality, cost-effective services, including medical, dental, behavioral, pharmacy, and vision care. Community health centers are a vital health safety net for more than 23 million Americans, including 7 million children and over 260,000 veterans. In over 9,200 communities, they are opening the doors of healthcare, giving more people the chance for healthier and stronger lives. Community health centers go beyond the traditional 4 walls of medicine to break down barriers that often keep people from getting the care they need, such as lack of transportation, language and cultural differences, income, and insurance status. Health centers also work in partnership with others in the public and private sectors, developing local strategies to address the root causes of poor health, such as nutrition and food insecurity, homelessness, environmental conditions, and unemployment. Community health centers are a leading model in primary care practice, helping to transform healthcare delivery in America to enhance quality and reduce costs. Years of research shows health centers are more accessible than other providers to patients who are new, uninsured, or have Medicaid. Health center patient outcomes are as good as or better than those of other primary care providers, even though health center patients are challenged with more complex health needs. Health center care reduces mortality, health disparities, and risk of low birth weight. Community health centers have broad support in the public and private sectors because they produce value, not only for their patients and local communities, but also for governments at all levels and the American taxpayer. When compared to other healthcare providers, health centers produce over $1,200 in savings per patient per year, and health centers generate $24 billion a year in savings across the entire healthcare system. Their patients are less likely to visit emergency departments for non-emergency care, and hospital stays are lessened or even prevented because health centers focus on prevention, patient education, and effective management of chronic and costly diseases. But health centers are more than just healthcare providers. They serve as economic engines in some of the nation's most resource-disadvantaged rural and urban communities, stimulating job and small business growth and purchasing goods and services. Collectively, health centers generate an estimated $26.5 billion in economic activity in local communities. Nationwide, health centers employ over 160,000 full-time doctors, nurses, and other healthcare professionals and support staff. And that includes our nation's veterans. They are often one of the largest providers of jobs and job training in their communities. As America's need for primary care doctors, nurses, and other healthcare workers continues to grow, teaching health centers play an important role in ensuring an adequate workforce for the future. And as frontline providers, health centers aid in protecting their communities and overall public health in times of widespread healthcare emergencies and natural disasters. Since their early beginnings, community health centers have been called on to do more and more, serving greater needs, and they have always answered that call, making people healthier, strengthening communities, and producing value. Yet today, 62 million Americans still live in areas with little or no access to doctors or health services. So the question is, will community health centers be needed in the future? The answer is yes. Imagine an America without them. America's Health Centers. Value in healthcare today and tomorrow.